Hello everyone, my name is Sokchin and I'm working on the Prominent Project 4.1 under the supervision of Professor Hedo and Professor Petra. The topic of my research is about integrating the multiple effects of a single drug to tailor type 2 diabetes. As we know, gaining an early understanding of ultimate efficacy of a drug is essential, as lack of drug efficacy often leads to attrition in the later stages of drug development. Efficacy of a drug is commonly measured by targeting on the single surrogate endpoint, for example, the HbA1c, blood pressure, or cholesterol. However, we know that most drugs act on multiple risk markers. ACE inhibitor, for example, they do not only reduce the blood pressure alone, they also induces albuminuria reduction. Similarly, novel hypoglycemic agents such as the SGLT2 inhibitors and GLP-1 receptor agonists, they do not only reduce the HbA1c, but also exhibit several hemodynamic and metabolic effects such as blood pressure lowering, albuminuria reduction, and body weight reduction. To better predict the long-term efficacy of a drug, we should then integrate the short-term effects of a drug on the multiple risk markers. Therefore, the primary objective of my study is to validate and implement a risk score known as the Parameter Response Efficacy Score, or PRE-score in short, which integrates the short-term effects of drugs on multiple risk markers for long-term drug efficacy prediction. PRE-score has several implications on drug development, drug registration, and most importantly, it brings forward the concept of personalized medicine for every patient. For drug developers, PRE-score would enable accurate drug efficacy assessment and provide better insights regarding the potential success or failure of the costly and large-scale hard outcome trials. Additionally, it allows improvement of study design and may prevent many patients from an ineffective or even harmful drug exposure. For drug regulators, PRE-score would enable accurate efficacy prediction, which can then be used as an additional evidence in the regulatory decision-making process for drug marketing authorization or drug registration purpose. And finally, PRE-score validation and implementation through clinical decision support tool, for example, may offer physicians and patients a more personalized tool to better estimate the overall effect of the prescribed drugs and better predict the long-term clinical outcomes of a patient. So that is all about my topic, and if you have any further question, please feel free to email me at the email address listed below. Thank you very much.